Okay, now this in the beginning when the capitalism and industrialization was taking over the world, everything was free. I mean, free. I mean, everything in everything you had a choice. It was based on individualism and stuff like that. And then gradually people realized that everything and every service is not same. There are things that which you may call discretionary, or which you don't have to have, and then there are things that are not discretionary. There are things that you have to have.
But who chooses that? Who makes that decision?
Individual, of course.
No, I think and with healthcare, it sounds like the government's going to make that decision. It's decided that you have to have healthcare. It's not indiscretionary. It's not a choice. You have to have it.
How you're going to survive without having healthcare?
How did we survive before without healthcare?
Before what?
Before healthcare.
Before healthcare was not this expensive.
But I grew up in a home in America. We didn't have healthcare insurance. We did not have healthcare insurance.
Who?
My family. We did not have it.
Because before the healthcare was not this expensive. Now it was expensive.
Well, no, listen to what I'm saying. I grew up in the United States of America. My father and my mother did not have healthcare insurance. We did not have dental insurance. Okay? Some people will say, well, how's that possible? We didn't. And it was too expensive then, according to my parents, or they may have felt like it wasn't necessary for them. Okay? So I'm just saying, why do we have to have it? Why is it a must?
It's a must because the insurance takes over the regular consumption when the cost goes too high.
That's not true.
That's not
true.
What it is.
No, that is the perception, but that's not true.
The thing is that when you realize that there may be instances when you will not be able to pay for expenses, that's when you buy insurance.
But now they've eliminated that. They're saying no, you have to buy it regardless. Like you said, initially it was to hopefully offset some of your expenses and to keep you from going bankrupt. But that's not everybody's case. That's not what even healthcare even addresses even now. With Obamacare, it doesn't even address that. Mm-hmm. It does not address the over expense. There has been nothing put in that healthcare plan to cut costs, to top cost out, and to make costs come down. Nothing.
Well, Obama's plan has a very basic element of cutting costs.
How?
The cost. See, this is how insurance works, which is this nationalized insurance. The government-run insurance. The insurance works on the pool of people.
A pool of everyone being a participant in it.
The larger the pool is, lesser is the cost.
That's the perception.
That's the way it is. That's the way insurance works. Every insurance works.
No,
that's healthcare.
I would agree that is the principle in which it's supposed to work. But you and I both know that doesn't work. State Farm has over 4 million policyholders. The insurance is not going down. It's going up every year 30%. And they're actually getting more people in the pool. Since Obamacare has passed, in the last almost 3 years, health premiums have gone up over 60%. Now, why is that? If you have this big umbrella coming to save everyone, why are the insurance companies gouging the people now before it is even instituted fully? I don't understand that. So I'm saying if it's based on pools, then why are premiums going up? Because people still have their private insurer.
The premiums are going up because a record number of people are losing health insurance. The insurance pool is shrinking.
Yeah, but their health insurance is tied to their jobs.
Right.
These aren't the people that... Give you an example. I am a policyholder with United Healthcare. Now, United Healthcare publishes how many policyholders they have and compared to last year. They haven't lost any policyholders. They've gained... No, I'm looking at the numbers that they send... they send you the numbers of saying this is how we are, how sound we are. When you look at their numbers, they haven't lost any holders. They've actually gained policyholders, but my health care premiums have gone up 60% in the last 2 years. So if your principle is accurate, I should be getting a discount because we have more people in our pool.
Another thing with health insurance companies is that health insurance business, the competition is limited. And they are just run by the profiteering, and that's it.
So basically, it's price gouging or legalized racketeering.
Right, it is. On the other hand, all the 26 countries, developed countries that have nationalized insurance, health insurance, their cost of insurance is much lower than us.
Because the government regulates it.
Of course, the government.
That's the only reason why. It's not because of competition. It's not because of policies. It's not because of the pool of people. It's because the government is the one who controls healthcare. Period.
Of course, in a nationalized insurance, there's going to be no competition. But
right. But initially, when he proposed his plan, he said you'll be able to keep your own private insurance if you want. If the government is the one who's regulating insurance and stymieing competition, there is not going to be a private insurance company because they can't compete with the federal government. It's impossible. You're talking about the weight of the government versus a private insurer. That doesn't work. You can't compete with that. So that's saying that for government to have national health care, private insurers don't exist. Or if they do, they are for a minority group of people, like the 1% that everybody's protesting against, who will get the better care. So you haven't created a better system for anyone except for the rich people.
No, the thing is that it's still, I think it's still better than kicking out one of every 6 Americans, about 47 million Americans out of the pool.
Who are these 47 million? Who are they really? Are they Americans? Are they illegals? Or are they a combination of both? Or are they foreign students who didn't go home? People who have a green card who didn't go home? Who are these people?
No,
who's the 47 million? Because it goes from 30 million, 11 million to 47 million. And probably by the election it's going to be another 55 million.
No,
who are these people?
No, this is CBO statistics.
But who are they?
They are Americans.
They cannot be Americans and not have insurance. Because in this country, if you have no insurance at all, you can walk in the ER without any identification and get health care for yourself. But any ER in this country.
But that's not health care insurance.
That's what people use for their health care.
That rises the cost a lot.
Nothing has stopped that, though. No, you still have a right to do that.
No, if everyone has insurance, then you will not have to wait until it gets so bad that you have to go to OR.
Have you ever been to Canada?
Preventive health care.
They don't do elective surgery after 6 months because they have no more money.
No, I have relatives in area and in Canada, and let me tell you, this is just a propaganda. If you see the real statistics, their waiting times are a little longer than
a lot longer.
No, not longer than us. A little longer than us, and. But the advantage with this is everybody is in the pool. We have 47 million people out of this pool.
The health care plan that he proposed doesn't cover 100% of the people. It covers 92% of the people. So you still have millions of people out of the loop. That hasn't made it better.
Because it's not mandatory.
It is mandatory.
No, it's not mandatory.
That health care bill is mandatory participation by everyone. It's the only way you can even make it work. If everyone doesn't participate, it doesn't work. No, and that's why they want a single payer added to it.
No, the thing is that you have a choice to have private insurance.
No.
And if your business is smaller than a certain size, then you don't have to buy health insurance.
There's not going to be a private insurer when the federal government takes over health care. It can't be. You can't have both.
If insurance companies are really competitive, they should be able to beat.
You can't compete with the federal government. And let me tell you something. I, as a person who's a practitioner who gets paid by the federal government, okay? I don't get paid directly because I'm not a physician, but as a third-party biller, as Allied Health. You know what our insurance payments are based on? You know who sets that payment? Medicare, Medicaid. Whenever Medicaid and Medicaid went down this year 30%, you know what happened to everybody else's payments? They went down 30%, okay? So since the federal government, Medicare, Medicaid, sets the price points, insurance companies follow right along with it, okay? That's not competition.
There should
That's
be.
not competition.
Well, there are still insurance companies that pay more than
No,
many.
they don't.
They do.
No, they don't. I am the one who gets paid by these companies, and I can show you what I got last year and what I'm going to get this year. It's a 30% decrease because Medicaid and Medicare decreased their payments by 30%.
Now, what is this situation that they are reducing payment by 30% and increasing premium by 60%? So
Thank you. That's exactly what I'm talking about.
That's like 90% increases.
So this is what I'm saying. Nothing has been put in the healthcare bill to change or to top out cost. Nothing. Nothing is there. Because when have you gotten a raise in the last few years?
I got raised this year after.
Was it a cost of living adjustment?
No.
What was it?
It was lower than cost.
So what was it, like 1%, 1.5%, 2%?
Yeah, it was like, I think 2-3%.
And what did you get last year?
Nothing.
Okay, so in the last 2 years, just say the last 2 years, you've gotten 2% pay raise. Your gas has gone up by at least 10 to 15%. All your utilities are doing the same thing. Just basic cost of living is exceeding all your food. I mean, that's at least 60% has gone up. Okay, so my point to you is this: with all these things escalating, there's no cap. Now, the cost to live is exceeding the price of the wage that you're earning. Wages are stagnant. Okay, you can say, well, the economy's turning around. These are the things that I look at when you talk about the economy turning around. If the economy is turning around, wages should be going up. They should not be stagnant or decreasing. The job that I was working at for 3 years, I didn't have a raise for 3 years. What I came in at 3 years ago is what I left in at 30 years ago, left up to today. So that's, my wages did not go up at all. My cost of living kept going up every year. 3.5%, 4%. I'm divorced, I have children, I pay child support. In the state that I pay child support, they have COLA, cost of living adjustment. I was getting an adjustment, or they were getting an adjustment every 2 years, 3.5% to 5%. My wages did not change. Okay, so when you talk about health care by the federal government, nationalized health care, and a private insurer, he's price gouging everybody because once this is fully instituted, he already knows he's not getting any more money because he can't compete with the federal government. You can't do it. There's no way to compete with the government. The buying power is too big.
So the current plan that is in place, which Republicans call Obamacare.
He calls it that.
Well,
that's what he calls it.
In that plan, there is no chance that government will become monopolist.
How can they not?
Government would have become monopolist if it was single payer or no.
That's the next thing to go. Once this is fully instituted, single payer is the next step. You know that, and I know that. Because it can't work unless you have single payer.
It will ultimately go to single payer.
It has to. That's the only way you can't fund it any other way. Which means everyone has to buy health care from the federal government. Period. Now, whether you use it or not is irrelevant. You still have to buy it.
See, the government's problem is that the government insurance plans like Medicare and Medicaid and all these emergency ER coverage and stuff like that, covering uninsured people, they get all the most sick and disabled people in their pool, and all the healthy people go to the private insurance.
Yeah.
Healthy and paying people.
Yeah.
So that's why the government plans are running a serious deficit.
Yep.
While insurance companies are making record profits.
Yeah.
Right? So I think that this ultimately if what was going to happen that government will have to absorb at least some of these healthy and paying customers.
But why? I mean, to me, why can't you do this? I mean, you have Medicare and you have Medicaid and all these little branches of this. Why can't that stay the way? Why can't that be reformed? Period. You know and I know, we work in the healthcare field where people who aren't even citizens of this country can come and take from the system and never pay one dime.
Well,
that's inappropriate.
See, the thing is that
there's no regulation to stop that either.
I say this. I say this, that the immigration policy is the basis of all our problems.
But they won't address that.
Our problem. But nobody wants to address that.
So you can't even